Let's talk about TRC, Transitional of Care. A few things you need to know about TRC. This is probably the least favorable healthcare effectiveness data and information set, HEDIS measure. At the same time, it's also a particularly important one given what we understand about the importance of transitions of care. The Centers for Medicare and Medicaid Services, CMS, defines a transition of care as the movement of a patient from one setting of care to another. For HEDIS, HEDIS purposes transitions of care is the percentage of discharges for members 18 years of age and older who had each of the following. 1. Notification of inpatient admission. 2. Receipt of discharge information. 3. Patient engagement after inpatient discharge. And 4. Medication reconciliation post-discharge. To satisfy TRC measure, you will need to have the following. 1. Notification of inpatient admission. Documentation of receipt of notification of inpatient admission on the day of admission through 2 days after the admission, 3 total days. 2. Receipt of discharge information. Documentation of receipt of discharge information on the day of discharge through 2 days after the discharge, 3 total days. 3. Patient engagement after inpatient discharge. Documentation of patient engagement, for example, office visits, visits to the home, telehealth, provided within 30 days after discharge. 4. Medication reconciliation post-discharge, MRP. Documentation of medication reconciliation on the date of discharge through 30 days after discharge, 31 total days. Oh yeah, in the changes for 2022, NCQA. Clarified that members in hospice or using hospice services anytime during the My Area required exclusion. Added physician assistant as an appropriate provider type to perform medication reconciliation for the medication reconciliation post-discharge indicator. Clarified in the notes that documentation of post-surgery follow-up without a reference to hospitalization, admission, or inpatient stay does not meet the criteria for the 5th bullet of the MRP indicator. Key points. As a provider, schedule the patient for a hospital follow-up visit within 72 hours, request medical records. Reconcile the medication from the hospital discharge. Exhaust all opportunities to eliminate hospital admissions. If the patients are frequent flyers, demand the patient to follow up 3 times per month. Demand patients notify you if they are admitted to the hospital right away. Document in the patient's chart when you are notified of the patient's admission. As an abstractor, review all components of the progress note. If medication is listed and the note is signed normally, this can be taken and medication was reviewed. If the chief complaint or HPI states the patient is being seen for a hospital follow-up plus the dates are present in the note, normally, and I quote normally, this can be captured as compliant. Check the patient's note section for any correspondence about admissions. Check the hospital medical records for this summary. If you would like to learn more, please visit our website woo.aimccs.com. Email us at billing_coding@aimccs.com to join our Facebook group.